I'm Dr. Victoria, and this is George.
Today, we are going to talk about smoking cessation. George has had a rather nasty habit of smoking. Right now, he's smoking a pack a day. He kind of knows that they are bad for him, and he doesn't like the dent to his pocketbook buying them does. But he's not sure if he'd like to quit, but he's open to talking about it. The most important part of this will be patient education. Some rather dour news is that over 7 million people die worldwide and over 480,000 people die each year within the United States due to the effects of smoking. That's where George and I live right now. Up to 1/2 of smokers will die from tobacco-related illnesses. If you play rock, paper, scissors with a buddy who smokes, one of you likely won't make it thanks to the cigarettes. The main causes of death from smoking are due to atherosclerotic cardiovascular disease, think heart attacks and strokes, but also is lung cancer and COPD as main causes. Any time or any age is a good time to stop smoking, whether 18 or 88. If one could stop smoking today, their risk of dying from the effects of cigarettes will go down. It will be uncomfortable. That pesky addictive nicotine will be nagging at our patients to pick up a cigarette, but we have tools to help. What can happen when our patients stop smoking? Well, let's start with the good things. There are numerous benefits to stopping smoking, but some may be hard to notice right away. We know smoking can lead to lung cancer, but that's not the only kind. Cancers can also occur at the colon, rectum, head, neck, kidney, liver, bladder, and pancreas. And these are just a few of the cancers, all linked to tobacco use. There's a big impact on the heart and arteries too. If patients could stop smoking today, they'll decrease their risk of heart attacks and strokes due to the damage cigarettes cause. For our patients with COPD, the smoking was a strong contributor to the development of the disease and continues to make it worse. It also worsens asthma and puts the patient and family members at risk for respiratory infections, everything from the common cold to pneumonia. Over the long term, smoking puts people at risk of developing diabetes. Many patients have friends or family members struggling with this condition who will tell them, do everything you can to avoid it. In the topic of reproductive health, it decreases fertility in both men and women. In females, it complicates pregnancy, making it a more dangerous pregnancy for mom and baby. In men, it makes it difficult to engage in intimate activities. Erectile dysfunction is a common complaint, and it is rarely received well that the patient's cigarettes are the culprit. Folks just want the Viagra, not the nicotine patch. The not so good. Nicotine withdrawal. Nicotine is the drug that keeps smokers coming back again and again. Without this drug, there are cravings and a few other symptoms that are most intense during the first 3 days after stopping smoking. But it does get better. These start to decrease over the following month, but they can, unfortunately, last for months to years afterwards. With nicotine cessation, there can be increased appetite or weight gain, depression or irritability, even anger, anxiety, difficulty sleeping, difficulty concentrating, and restlessness. The weight gain is on average 8 to 10 pounds, but it can be greater. The more someone smokes, often the greater the weight gain that occurs. Is it worth it? Us doctors think it's worth it to stop smoking. That's why we bring it up at every visit. That's how we show our patients we care about them. Is it good enough to just cut down? Smoking has been widely studied, and the evidence doesn't seem to show that cutting down is good enough for most people. Even low levels of tobacco smoke can increase cardiovascular risk. That's why we take secondhand smoke and even third-hand smoke so seriously. Secondhand smoke is when you're around someone who smokes, and third-hand smoke is when someone who smokes has the particles from the cigarettes left on their clothes, and say they go in for a hug, especially important for children and infants, who then breathe in the particles. One of the risk factors for sudden infant death syndrome is secondhand smoke and third-hand smoke. Time with grandchildren isn't so fun when you are told to bring a new change of clothes that don't have smoke on them just for the visit. Make sure to congratulate your patients on the decision to quit. That is half the battle. Sometimes it can feel overwhelming to quit on your own, and it is important to seek community who can help cheer you on. Your doctor can be part of that. friends, and some family who you feel comfortable sharing your goals with, and some kind of support group or counseling to help keep you on track, and to have that community to have the reassurance and know you are not in this alone. Counseling equips patients with skills to help cut the habit. Individual, group, phone, and text messaging counseling have all been shown to help in stopping smoking and is better than just medication for cravings alone. Take a look at the description below for some resources on smoking cessation. Our main medications of choice are Chantix or Wellbutrin, as well as nicotine replacement therapy, including the patch, gum, and lozenges. We like to attack the addiction from all angles. Some medicine to help ease the transition off cigarettes, and usually 2 kinds of nicotine replacement. The nicotine combination that works best is the patch and either gum or lozenges. We still give the nicotine even though we want to wean off that eventually as well, so that the patient can start to build the health benefits that stopping smoking leads to right away. It's not just nicotine in the cigarettes, and all those other ingredients are bad news. Chantix, aka varenicline, is a partial agonist at nicotine receptors. We want to prescribe a taper. We start with 0.5 milligrams for the first 3 days, then for days 4 to 7, 0.5 milligrams twice daily. On day 8, patients should quit smoking, and also starting at day 8 and continuing for 12 weeks of treatment, we want 1 milligram twice daily. There are alternatives. You can quit between day 8 and 35, or start to decrease the amount of cigarettes, 50% by week 4, and again another 50% by week 8, with the goal of completely stopping by week 12. Wellbutrin, aka bupropion, is also used as an antidepressant and is a dopamine and norepinephrine reuptake inhibitor. So if a patient has some depression as well, this might be the better choice. We taper up this medication as well. Start with 150 milligrams once daily for 3 days, then 150 milligrams twice daily thereafter. We should start this medication at least 1 week prior to a quit date, usually in the 2nd week of treatment. If patients are successful in quitting, treatment should continue for at least 12 weeks, and maintenance can continue for a year. If after 7 weeks patients are not successful, it's better to try a different treatment modality. For the oral habit of bringing something to your mouth, patients can try sugar-free gum, lollipops, or sometimes a simple popsicle stick is all that's needed. I would not recommend vaping as an alternative to wean off cigarettes, but that is a whole other video. People usually end up using more nicotine than they would with cigarettes, and instead of hot smoke hurting your lungs, folks have what is similar to hot steam boiling their lungs. Still bad news. Most people keep the nicotine addiction, only switching from one delivery system to another. I know it is hard to quit. While I would love every patient to stop smoking on the first try, I do expect some relapse and know that it can take several tries to cut the habit for good. The counseling component of treatment can be very helpful in staying motivated and having accountability. If patients tried quitting in the past without any counseling, reconsider including it when someone is trying to quit again. Frequent follow-ups are probably a good idea so that we can keep track of progress. For George, we'll set him up on an app for his phone, and I'll work on convincing him to join a support group too. We'll start that Chantix taper and use a nicotine patch and some lozenges for breakthrough cravings. Thank you for joining me today, my healthcare team. Quitting smoking is no joke, and it can take many tries. While it's not easy, we can drastically improve the health of our patients and their families, and save them some money too. I hope you'll join us next time to see what George gets up to next. Bye-bye!